occupation for the court.
My name is Casey Highlander, and I am a psychologist and guidance counselor at Phillips High School.
And what background do you have in psychology?
Well, I received my BS in psychology from Case Western Reserve University, as well as a PhD and an MA in educational psychology from the University of Toledo. I graduated near the top of my class, and I published more than a dozen articles in child psychology, especially concerning antisocial behavior. In 1994, I was licensed by the state of Ohio as a practicing psychologist, and I have twice won the award for excellence in child developmental psychology from the American Institute of Psychologists.
So what field experience, if any, do you have?
Well, prior to my licensing by the state in 1994, I actually completed a 2-year clinical internship with a practice located in Phillips, Ohio. Following my licensing by the state, I formed my own practice that coincidentally also happened to be located in Phillips, on which I served as a child psychologist. And in 1999, I would go on to form another practice, this time with the aid of several other local prominent psychologists.
Could you please tell us a little bit more about this practice established in 1999?
Well, the practice in 1999 was called Ohio Psychological Services. My role at this practice entailed diagnosing and treating developmental and learning disabilities while helping children to manage their behavior. I would go on to leave this practice in 2005, but I can assure you that during my time there, the practice did nothing but thrive.
And, Your Honor, I would now like to move to establish Dr. Highlander as an expert in the field of child psychology.
Granted without objection.
Thank you. Now, are you still a counselor for Phillips High School?
I am.
So what is your role as a guidance counselor there?
Well, as a counselor at Phillips, it's my job to provide counseling, instruction, and mentoring for those students who suffer from social, emotional, and behavioral problems. It's also my job to work with students and their parents to address behavioral and learning issues that may inhibit their abilities to succeed either in school and long-term in life.
I see. Can you please give some examples of how you try to embody these objectives in your work?
Well, the school actually holds a 3-day retreat for incoming freshmen. The purpose of the retreat is to foster a sense of self-worth amongst the children, as well as acquaint the incoming freshmen with their class. It was actually in 2010 that, on this retreat that I met Dakota Allen for the first time.
And what was your initial impression of Miss Allen? What characteristics could you see in her?
Well, Dakota was never an overly cooperative student. She, in fact, refused to unpack at her designated location, called the chaperones morons, and even went as far as calling the retreat completely pointless and stupid. Despite her lack of amiability from the get-go, I'd say that Dakota did display a very strategic approach and was very successful in several of the Survivor-style games. By the end of the retreat, I had concluded that Dakota was an intelligent, confident, and calculating student who was somewhat prone to engaging in antisocial and disruptive behavior.
How did Miss Allen act when school started?
Well, Dakota was sent to the principal's office a number of times, either for fighting with fellow classmates or speaking out in class. Dakota was handed down disciplinary measures whenever they were necessitated, Overall, I'd say that Dakota acted in a very disruptive manner.
How do you and the school specifically handle disciplinary action related to the students?
Well, it's the school board's policy that any severe disciplinary measures, before they're handed down to a student, that student must meet with the guidance counselor before, as I said, before the measures can be handed down. As such, I've met with Dakota a number of times, and she and I are very well frequented to this point.
Okay, thank you. I know we've been talking about the defendant's behavior, but I'd like to move on to the topic of the defendant's medication. So, what type of medication does the defendant take?
Dakota takes a type of prescription medication called Alen.
And how familiar are you with this drug?
I would consider myself very familiar.
Why is that?
Well, there are a variety of reasons. First thing is that I have worked with a number of children, students and patients alike, both in my high school career and in my private practices, in which I dealt with children that were either taking Alen or very similar other substances. I've also recommended such medications to a number of my patients. I've also, as with all medications in my field, I try to keep up to date with the latest studies, publications, and literature concerning Alen to ensure that I have the fullest possible understanding of Alen and its various uses.
Now, what is Alen used for?
Adeline is used to treat attention deficit hyperactivity disorder, or ADHD as it's more commonly referred to.
So what side effects, if any, are associated with Adeline?
Well, there are a few that can occur, such as headaches, panic attacks, and anxiety, but when Adeline is used correctly, side effects are generally very minimal. In addition, those patients that are taking Adeline and stop usage can exhibit withdrawal symptoms that are very similar to the side effects.
Now, you mentioned withdrawal symptoms. Can you explain how severe are these withdrawal symptoms?
Even the most severe withdrawal symptoms are not generally life-threatening and have a very low impact on cognitive ability.
And how frequently does Miss Allen seem to suffer from these symptoms?
Well, to be honest, I can't say exactly how often she seems to suffer from these symptoms. What I can say is that she seems to cite these symptoms as an excuse quite frequently.
How exactly does the defendant use these symptoms as an excuse?
Well, there have been a number of times in which Dakota has been sent down to my office for behavioral issues, in which she supposedly told the teacher that she was suffering from withdrawal symptoms. Yet in every one of these instances, Dakota later informed me that she had not been suffering from withdrawal and was simply citing withdrawal as an excuse to escape any form of punishment.
And based upon your knowledge of the defendant, what would you recommend for her?
Well, in my opinion, Dakota is not dependent upon the medication. In fact, if I were to recommend anything to her primary care physician, I would certainly, I don't believe that medication would have been the first thing I would have gone to. In fact, it's also my opinion that Dakota's behavioral issues are more environmental than neurological in origin. And as such, I likely would have recommended counseling and therapy as an alternative to medication at that time.
Thank you, Your Honor. No further questions.
Ross?
Yes, Your Honor. Good afternoon, Dr.
Good afternoon.
Now, is it true that you are not a medical doctor?
I am a psychologist, not a psychiatrist, if that's what you're referring to.
Yes. And yet, you recommended the drug Adeline to several other students?
Certainly, it's absolutely within my right to recommend.
And since you are not a medical doctor, would it be correct to say that you can never fully understand the side effects because you have never witnessed them in a clinical trial? Would that be correct? A yes or no will suffice.
I'd say no in that situation.
Now, you said that Miss Allen, in your statement, can be cooperative when she's relaxed and calm.
Can be.
Is it possible that she is disruptive or antisocial because she does not feel relaxed or calm?
Objection, Your Honor. This question calls for speculation. My witness simply does not know and would have to speculate in order to respond to this question.
May I rephrase your?
Sure.
In your expert opinion, could it be possible that someone similar to Miss Allen could simply be reacting badly in school as an action of, or a form of showing uncomfortableness or not being relaxed?
I'm sorry, I didn't quite understand the question.
In your expert opinion, is it possible that someone similar to Miss Allen could not behave well in classes because they feel uncomfortable?
I suppose there are a variety of reasons that children such as Dakota or those in similar situations could act out.
Thank you. Now, do you remember the incident where Miss Allen falsely confessed to pulling the fire alarm because she had not had medications?
She was late that day, and there were a variety of other things affecting her, but I do remember the situation you're calling in question.
Thank you. Now, in your expert opinion, could something similar be happening in this case for confession? A yes or no will suffice.
Objection, Your Honor. This is outside the scope of my witness's range of expertise and knowledge, simply because it calls for one, a hypothetical, and two, he does not necessarily know, he's not an expert in this case.
May I respond, Your Honor?
Yes.
Since you classified him as an expert witness and he has daily contact with my client, Miss Allen, he therefore has some insight into her day-to-day lifestyle, her processing abilities, and how she reacts in different situations. Therefore, I believe that he is qualified to give a speculative opinion.
May I reply, Your Honor?
Objection's overruled, if you know.
Oh, I'm sorry, could you please say the question once more?
Yes, in your expert opinion, could something similar be happening in this case where Ms. Allen would give a false statement against herself because she had not had her medications?
Well, if we could revisit the fire alarm scenario for a moment, I previously also stated that there were a variety of factors that were affecting her, and I didn't say with any definity that withdrawal was affecting her, so I would say the same thing, that in this situation I would say that withdrawal may or may not have been affecting her. I can't truly know, as I'm speculating, as you've stated.
Thank you. Now, Your Honor, may I have a moment to confirm with my co-counsel?
I'm sorry?
May I have a moment to confirm?
Yes.